Hi guys, so welcome to part one of a sequel of videos. This one is all about the aim of our actual program, the treatment methods, and the difference in what we think between an injury, an insult, and an actual condition in the body. To give you an insight into the aim of this program, our main aim is obviously to remove pain, correct dysfunctional psychological conditions and psychosomatic stresses. We do this by eliminating irregular tensional patterns that have manifested in the body due to poor postural habits, injury, and poor lifestyle habits. Lifestyle habits can be anything from a sleeping position, it can be your job, you could be doing a repetitive action, that would also lead into poor postural habits. You could be a hairdresser, you could be sitting at a desk all day and so on. So this is how people pick up these bad habits. You may sit cross your legs a lot during the day and so on. You may be in a lot of pain and you might have to slouch and kind of load one leg over the other. Psychosomatic stresses and different things, it kind of freaks people out, but at the end of the day, psychological conditions it's all proven now as in regards to the trigger from when a thought pattern happens to what actually happens in the rest of the body, and the increase in tensional stress, which now is known as anxiety and so on, and that is represented from the main emotions of fear, worry and so on. The treatment method, again, we mentioned when we correct tensional relationships between nerves, muscles and bones, ensuring that all myofascial trigger points will be removed over the course of your plan. This will be done through the use of our microcurrent and various treatments. Various stimuluses go in at a specific frequency in order to remove trigger points. It may be to deep stimulate some nerve endings that have been known as neuropathy type injuries. You may have had a stroke, you may have lost power in a limb and so on. By restoring this, the systematic and involuntary function of the sacrospinal cranial system. So again, this is done in a series of treatments that we do, which would be where we read the actual spine from practically C0 all the way down to the coccyx. Obviously, from a chiropractor's point of view as well, there is a lot of studies there to show that various nerve endings coming off specific vertebrae will calm down specific parts of your autonomic nervous system. By doing this, we actually naturally then restore the balance between muscular tensions, which is known as tensegrity. Obviously then, when tensions are balanced, our skeletal structure is ideally positioned to permit proper nerve transmission. So many times we all know that we get a bit of needling done perhaps in the hip and it just gets us out of pain from, say, sciatica for a while. However, it's tensional relationships that are thrown off that keeps bringing back this particular injury. It may again be from specific tensional patterns caused by an emotional injury. It may be a blockage that's stored in the body, and this is obviously the idea of the whole treatment process and why we try and convince people who have had a chronic injury to work with us that little bit longer. And finally, the fundamental principle, the patterns of muscular imbalance pull the bony skeletal system out of place, causing pressure on nerves and discs, resulting in stagnation of the vascular, visceral, endocrine, energy and fluid systems of the body, creating further consequential muscular imbalance with more chronic and degenerative outcomes. Obviously, when we go to the chronic injuries, we have to look at the damage that's going on in maybe 15-20 years. We may have got operations and we actually never truly remove that scar tissue. Treatments such as cupping, dry needling will never remove the scar tissue to the length that these individuals experience with. The microcurrent, there is no other treatment out there that will actually get the results. And I'll just finally finish on, what we class as an injury. An actual injury would be a torn or ruptured muscle or tendon or ligament, maybe a fracture or a break, or in, down the line of, we talked about the chiropractor with herniated discs and bulging discs and so on. They would be specific injuries. Whereas an insult would be what most people present with. They can't figure it out. They have an IT band syndrome type thing. They have a tendonitis. They have a tendinopathy. It depends on the stage of the injury. And then obviously a condition would be the last thing that we would be dealing with. And they could be anything from IBS, fibromyalgia, there's polymyalgia, there's MS, there's so many. So that's just giving a quick synopsis of the treatment method and a very overall view of what we actually aim to do.